It is time for Move Well, Live Well, and I'm joined by Dr. Peter Chimenti, hand surgeon with PCI Orthopedics, and we're going to be discussing issues that affect the hand and wrist, specifically repetitive stress injuries.
Yeah. Exactly right, Chris. Thank you so much, first of all, for having me on. It's a pleasure to be here. I look forward to hopefully sharing some tips and tricks that can help your viewers with some of their hand issues.
Right. So I know one of them we're going to talk about is carpal tunnel, and that's one I think a lot of people have heard of, but maybe they're not familiar with what all the actual symptoms are. So what exactly is carpal tunnel syndrome? Yeah,
so carpal tunnel is probably one of the most common conditions that present to our office. And when people have carpal tunnel, they come in complaining of numbness in their thumb, index, and middle finger.
Okay.
And that numbness can be at night. It can wake them up from sleep at night, shaking out the hand overnight, causing burning discomfort, or it can be during the daytime, common things while driving. This can be a very common thing that they complain of. If we take a look at the model quickly, we can see why that is. We'll see that there's a nerve. The yellow thing right here is the nerve, and that actually branches out to affect the thumb, index, and middle finger. So that's why people get that numbness in that specific area, and literally the nerve is running under a tunnel. This tight band right here, this ligament, pushes on that nerve, causing it to get numb. So that's what people are going to come in complaining of primarily.
Okay. And when should they actually seek professional help with that?
Yeah, absolutely. So one of the first things they could think about doing at home is avoiding the kinds of things that are going to precipitate the condition.
Right.
So vibration exposure in particular can be one of the things that trigger it. So using power sanders or jackhammers is pretty rare, but I mean, the more they're exposed to vibration, they're going to trigger that condition. So avoiding it, resting it, and taking time, that's a theme we're going to see throughout a lot of these repetitive injuries, giving it time to heal. Right. From there, the best thing to do at home is a brace. So you put a brace on this thing at night. Doesn't have to be anything fancy, just keeps the wrist nice and neutral, not bent back, not bent forward, nice and neutral, and try that overnight. And that helps most people so they can sleep through the night.
Okay.
If it's at a point where they cannot, where the brace isn't enough and their quality of life is impacted to the point where they want something else done, then it's time to come seek care, and at PCI we can certainly help out with that if they come see us.
Because I know a lot of people, that's part of their job, so they have to, you know, that repetitive motion.
Right,
they can't,
and sometimes they can't stop it.
Right.
Exactly.
Exactly. The next one we're going to talk about is one that I'm a little less familiar with. It's trigger finger. So what is trigger finger?
Yeah, so again, trigger finger, another repetitive kind of overuse injury. And so it can be associated with some metabolic conditions, so diabetes can predispose you to getting trigger finger, sometimes rheumatoid and some thyroid conditions. In the absence of all those, then it's usually overuse or repetitive use. So again, same advice would apply. Rest, take some time for things to heal, take some ibuprofen if you can tolerate it. But what's happening with trigger finger is that there's an inflammation or a tendinitis of the tendon. We can see that on the model. Right here is where the problem is. So people are going to report pain in their palm. And the finger literally will trigger. It'll get caught down in flexion and it'll snap back out straight. And that's a pretty dramatic thing, hard to miss clinically when you see it in the office. And the problem again is located right here. So to treat it, we can give them at home, what people can consider doing is putting a splint on it so that they don't sleep with the finger bent down. Again, it's one of those things where in the middle of the night and first thing in the morning, they're going to wake up with that finger locked down and be pretty painful.
Yeah.
So what they want to do is for at home, just put a simple splint on it and see if that fixes it. If that isn't enough, again, that's when it's time to come see us, and we can offer steroid injections is generally considered standard of care. That's the first thing you would do for it. If those injections aren't enough, there's a small outpatient surgery to release that tendon right there, allowing it to glide without getting caught, so it fixes that catching of the finger.
Okay.
It's a couple-week recovery and back to action pretty quick.
Okay. We're going to also talk about texting thumb, which I feel like is kind of a newer, I guess, repetitive injury because, yes, you know, 20 years ago we didn't text as much. Now, I don't know, we're on our phone how many times or how many hours a day?
All the time. All the time,
and I notice my hand like cramping up if I'm on it, you know, either texting or playing games. And is that kind of what?
That's certainly one of the things that can lead to it, right? So historically, texting thumb used to be called mother's wrist. It's mother's wrist, and so that was, you know, mothers of newborn infants picking up their infant in the wrist in this position, going to aggravate the tendons on the side of the wrist here, and we can see that again on the model here. We see these two tendons as they are running under that tight tunnel. Same idea as the trigger finger, where the tendons are getting pinched as they run underneath that band of tissue. With texting thumb, as we interface with that technology, we generally bring our hands in flexion and our thumbs out to the side as we're using the fingers like this. This again is putting a lot of stress on these two tendons, leading to that repetitive overuse and that inflammation. So again, put the phone down for a while.
No.
Take a break, put some ice on it, you know, this sort of thing. The texting thumb is a little bit different as far as home remedies that people can do, because a brace actually isn't particularly beneficial for the texting thumb. So
you can't put a brace on and go back to texting?
It's not, no, not right back to it. Yeah. So for this, again, when things are beyond their ability to tolerate it, this is when it's time to come see us. And for that, again, steroid injections considered the first thing to offer for that. And again, a small outpatient surgery to release that banded tissue, needed only in very rare cases.
Okay. I feel like a lot of hand injuries are repetitive unless it's a break or a high impact. Yeah.
Cuts and breaks and stuff, we also see plenty of those.
Yes.
Yep.
But I'm sure you see the majority of the repetitive.
A lot of times, both from hobbies and from work and all kinds of things. So
all right.
Our goal is really to get people back to their functional status.
Back to normal.
It.
Right. Back to texting.
That's it.
Thank you so much, Doctor.
Absolutely.
I appreciate it.
Thank you for having me.